So there are many components that make up an effective estate plan. One of those is I talked recently about a will. But other than a will, there are trust is oftentimes part of an effective estate plan. But one common misconception that we run into is that most people think that an estate plan only has to do with once you've passed away. But an effective estate plan actually deals with you once you have a life event that causes you to become incapacitated. So we may have other documents, oftentimes other documents that are just as important as a will or a trust, and that may be a financial power of attorney. Oftentimes we want to make that a durable power of attorney, which durable means that it's going to go into that time when you are incapacitated. A durable financial power of attorney is going to be able to allow your power of attorney to manage assets while you are incapacitated. And they will continue to do that until such time as you're no longer considered incapacitated or you pass away. The other documents that we deal with in an effective estate plan are your health care power of attorney. A health care power of attorney, similar to a financial power of attorney, but what you are saying in a health care power of attorney is that you will designate this person to be the person, your power of attorney, to be able to make decisions for you concerning health care. So that's whether or not you need to be in an institution, hospital, assisted living facility, skilled nursing care. The person's also going to make decisions as to what medications you're going to receive, what surgical procedures you may receive. They're also going to be the person that's in charge of the document that here in Idaho is called an advance directive or living will. That document is truly an end-of-life document. It is really only comes into use under two circumstances. One, you have an incurable injury, disease, or illness that's considered to be terminal. Two medical doctors have examined you and determined that, and where the application of life-sustaining procedures of any kind would only serve to artificially prolong your life. Or if you've been determined to be in a persistent vegetative state. That document gives you choices. It gives you the ability to decide when it is time for you to receive extra care, such as keep you connected to every possible life support procedure, or to withdraw those, or to continue food and water, or to withdraw food and water. So that's what an advance directive or a living will does. We also include what's called a HIPAA authorization. I'm sure you're familiar with the Health Insurance Portability and Accountability Act. Every time you go into a doctor's office, they make you sign a release. We also do one so that your healthcare power of attorney can talk to your doctors and vice versa, so that they're not in violation of any of the laws that we have in place to protect your healthcare information.